Say this, believe me, as a physician, I was watching what was going on. We were first looking out to try and see how do we treat this thing? What is going on? What blood work can we do? IL-6, your inflammatory markers, CT of the lungs. There were no tests. And we were trying to find answers, but we did pay very close attention to the trials of Operation Warp Speed. And it was fascinating to, be a part of that in some way. We would meet with Dr. Fauci, Dr. Collins, et cetera. But we knew from the trials that people that got vaccinated still got COVID. In general, they didn't get as sick, and they were less likely to be hospitalized, and therefore less likely to die. But it was still happening. So I'll ask you the question, to the best of your knowledge, had any passed away? When he made that statement in June of 2021.
If I might, Dr. Wenstrup, let me just also thank you for your work in promoting vaccination. Many videos of you doing vaccine clinics that yourself. So I want to thank you for your efforts there. It was much, what I will say is my understanding of the initial clinical trials that were released in November, December, before I became CDC director, was 96% protection against symptomatic disease. In medicine, we never say never. But
exactly. Exactly. So thank you. And that's the problem I have with this statement from the leader of the free world, is to say something so definitive. You're not going to be hospitalized. Even in the trials, people were hospitalized. You're not going to the ICU as a definitive statement. That was misinformation. That was divisive. That was dangerous. And it put you in a very hard spot. It put you in a very hard spot as you are to be the leading voice for America. And I applaud so many of the things that you have done and did do. But this is a problem, and that's the point I'm trying to make, that we cannot let this happen. We have to let science be the science. And in my opinion, we should have been hearing from the doctors who treated COVID patients, not politicians, not someone in the lab. So one more question. So just to be honest, we know the vaccination saved lives. We know it's not perfect, but there were breakthrough cases and there were deaths, and we have to do better going forward. I now recognize the ranking member of the full committee, Mr. Raskin from Maryland, for 5 minutes of questions.
Thank you, Mr. Chairman. Dr. Walensky, you're a graduate of Churchill High School in beautiful Montgomery County, Maryland, and the people of the 8th District are very proud of your devotion and your commitment to the public health and public education. In October of 2022, the Select Subcommittee on the Coronavirus, led by Chairman Clyburn, which I served on, uncovered a deliberate campaign by the then leader of the free world, former President Trump, and his associates to distort and politicize the CDC's COVID-19 public health response before the 2020 presidential election. This disinformation strategy is best described by Trump's own political appointees. President Trump's COVID-19 coordinator, Dr. Deborah Birx, who has famously told America that the Trump administration could have prevented hundreds of thousands of deaths from COVID had it acted effectively to address the epidemic, stated that Dr. Scott Atlas, another Trump appointee, quote, was overtly mixing public health with politics by advocating the idea that case identification is bad for the president's reelection. Dr. Paul Alexander, a Trump appointee, former senior policy advisor in CDC's Office of Public Affairs, said this: here's the issue. If the communication is left with just the statement that minority groups, sick, are at higher risk than on its face, this is very accurate. However, in this election cycle, that is the kind of statement coming from CDC that the media and Democrat antagonists will use against the president. Each time we talk about these deaths, we need to tell the nation why these deaths happened. This was due to decades of Democrat neglect. President Trump and his allies not only spread medical disinformation about quack medical cures like hydroxychloroquine and injecting yourself with bleach, but they lied to the American people very explicitly for their own political benefit. In discussing the importance of getting accurate scientific information about COVID out to the people from CDC, Dr. Martin Cetron, director of the Division of Global Migration and Quarantine, told the Senate, the Select Subcommittee during a transcribed interview, quote, "There are people no longer with us that would have benefited from that kind of very clear messaging." Now, Dr. Walensky, do you agree that accurate science-based public health guidance would have saved lives that we lost during the COVID-19 epidemic?
That has been my goal. Thank you. First of all, go Bulldogs. But that has been my goal since I got here, is to provide the most up-to-date information that we have, tell people what we know, tell people what we don't know, tell people that things may change if we have a new variant, for example.
But why has that been your goal? Why is it so important to get accurate, scientifically based information out to the people?
Because that is how they make their own risk-based decisions. It is they are making their own decisions, and they are doing it based on what they hear from scientific experts, from leaders in the field, and that is how they should be making those decisions.
Right, but presumably you want them to make scientifically based
Of course.
decisions, because that will protect their own health
Of course.
and safety. So if the government is involved in putting out distorted information or propaganda or disinformation, it is going to undermine the public health.
And that was actually among the challenges as I came in, and in fact among the challenges that have been discussed here this morning.
Well, tell us about that. What kind of challenges in terms of staff morale and public trust did you inherit when you became the CDC director?
Look, we have an agency, I'm gifted to have an agency that works 24/7 to protect Americans. We have people who were rappelling out of helicopters to drop test kits onto the Diamond Princess. We have people who have gone door to door in Ohio during the Ohio train derailment for hours on end. We have people working in Ebola treatment centers doing infection control, and they are now seeing the vitriol splashed across the pages of the work that they are doing. Their job is to work 24/7 to protect the nation and protect health. And we do that through all of those activities and through releasing science. And when they are undermined, you see risks to their lives. You see people leaving. I think there's an estimate that about half of public health workers across this country have left the field because they've been threatened. That does not help public health in this country.
Well, and I want to thank you for your devotion to getting scientific facts out to the people in pursuit of the public health. And if Donald Trump's apologists are really worried about plummeting confidence in government and in public health, they should look at the lies and the serial manipulation of the facts that were engineered by Donald Trump and his administration in their spectacularly failed response to COVID-19. I'd like to ask unanimous consent to enter into the record an October 2022 report titled, "It Was Compromised, the Trump administration's unprecedented campaign to control CDC and politicize public health during the coronavirus crisis," that was authored in the last Congress, Mr. Chairman.
Without objection.
I yield back.
Gentleman yields, and now recognize Dr. Miller Meeks from Iowa for 5 minutes of questions.
Thank you, Mr. Chair. And Dr. Walensky, it's nice to see you again, and thank you for testifying before the committee today. And let me just be the diplomat in the room and say that both administrations failed the United States public in its response to the pandemic, and that, in fact, is why we're having this hearing. And thank you, Chair Winstrup, for conducting it and for the questions that you have asked and have posed for us to ask, so that our next response to the next pandemic, which we know is coming, is better, and that we're better prepared for it. As you know, this select subcommittee held a hearing in April on the consequences of school closures, in which Randi Weingarten testified as the only witness. She vehemently denied coordination between the American Federation for Teachers and supported the scientific expertise that her union offered on COVID transmission rates among children. Mind you, her experts did not consider the American Journal of Pediatrics findings that showed children were poor transmitters of the coronavirus, or the data from Sweden that showed 0 COVID deaths amongst children aged 1 to 15, despite keeping schools and daycares open for all of the spring in 2020, or the fact that schools were open in Europe, or the fact that there were schools, private schools and public schools, that were open here in the United States. My state in Iowa had reopened schools in August of 2020. And let's not forget the American Federation for Teachers is not a scientific body. The data show that not only are children poor transmitters of the virus, but they're also, unless they are at high risk, at very low risk for hospitalization and death. The CDC is supposed to be the nation's leading science-based communicable diseases agency, not preventable medical diseases or climate change, although those things are very important, with public health being the #1 goal, especially as related to communicable diseases. At multiple points throughout the pandemic, the CDC issued not only confusing guidance that was seemingly not based on real-world data or evidence, but blatantly false information that fundamentally and permanently damaged people's lives and led to loss of trust. And I, having been a former director of a state of public health, admire your commitment to your agency and your staff. I had the same to my agency and my staff. And I also know how extraordinarily difficult the job is that we do, bringing science into the real world and making decisions and recommendations for individuals to follow. But this occurred in the form and our response to the pandemic and response to lockdowns and shutdowns occurred in the form of mental health decline, learning loss, economic instability, and a loss of trust in some of our premier institutions. And among one of the CDC's pandemic failures was its guidance on school closures. And I understand what you're saying here today was that there were certain things that you declined to act upon with triggers, but there were other things where recommendations were seemingly followed at the CDC's guidance. On February 12th, 2021, CDC issued updated guidance on school operational capacity, which effectively condoned the continued closure of schools, whether it was tacit condonement or implied. Again, this was despite clear data that showed children, especially within elementary schools, were not super spreaders and that teachers were no more susceptible to infection or death than those in any other profession at which people were working. You also said that you looked and that you wanted to have the most up-to-date data and that it was locally based. And so we wondered, did you use real-world evidence? Was this brought into the bear on what your recommendations were? After the April hearing of Ms. Weingarten, I received a letter from her lawyer at ATF, which amongst other things said that I belittled the scientific expertise that was available to the AFT. He supported his claim by leaking an article that discussed COVID-19 transmissions in households, not schools, and suggested that I keep an open mind and show some humility. Those things have not been previously described to me. However, I'd like to enter these both into testimony. The article by which they are submitting on COVID-19 transmissions in households is from June of this year, so would not have been available as scientific data. So, Mr. Chairman, I ask unanimous consent to enter this letter and the accompanying article into the record.
Without objection.
Dr. Walensky, can you explain to this committee what data the CDC reviewed when developing its school reopening guidance, whether the CDC considered the American Journal of Pediatrics study or data from Sweden or Iceland? And did you consider data and information from school systems that were already open in developing the guidance? And additionally, will you admit that COVID transmission in schools, especially elementary schools, was low enough to not justify school closures?
Thank you so much for that question, Dr. Miller-Meeks. As part of our scientific brief, when we released and just to be clear, it was not a document to close schools. Many of the schools were already closed. This was operational guidance to get schools open and keep them open. But in the scientific brief that went along with that operational guidance, we had reviewed publications from the UK, Israel, Switzerland, Norway, Germany, Italy, and more. I can tell you that there was not a lot of published data from Sweden. There was a study subsequently from Sweden that demonstrated that Swedish schools that had in-person learning, their teachers had twice the infection rate as those that had closed. And I can also tell you by late spring that Sweden had actually had overwhelmed hospitals and had ultimately decided to close the schools for people who were over the age of 13. So we did absolutely look at data from other countries as we were doing this. Again, part of the operational guidance, and you speak to what happened in Iowa, but part of the operational guidance was to look at your local community transmission and to say if your local community transmission is low, we really encourage our kids to get back to school. That was entirely the point, as has been noted before. I also want to highlight that the American Academy of Pediatrics at the time supported our guidance when it was released. So we had support from not only public health workers throughout CDC as our guidance. We had done a lot of engagement with our partners and implementing partners, but we had support from the American Academy of Pediatrics. Thank you.
Thank you. I yield back.
I now recognize Mr. Mfume from Maryland for 5 minutes of questions.
Thank you very much, Mr. Chairman. I want to thank you and the ranking member for calling this hearing. Director Walensky, thank you very much for being here with us. Just a couple of things and some thoughts and maybe one or two questions. We seem to always think about the pandemic as if it were some great big novel that had chapters that as we read it, we knew what to expect. We did not know what to expect with this. We were operating in real time, and I've said that at each beginning of each one of these hearings. It's so easy to go back and to be a Monday morning quarterback or to claim to be doing the kind of investigative work that we are sure about the outcomes were. This was real. And the fact that healthcare workers have left in droves because we've bastardized what they've done, we've made them feel bad, we've deemed their efforts not worthy of what they should have done in our opinion, we've questioned their tenacity. We keep always making this reference to European countries without doing all of the proper research. I mean, transmission rates in European countries were not apples to apples when compared with the U.S. It's important for us to say that, and I know it's novel and interesting and quick to be able to say, well, they did this in Germany, France, Sweden, et cetera. But just the fact that even in Sweden, as we just heard, infection rates for teachers were some of the highest rates that were being recorded. So it's oftentimes good to pump the brakes and to recognize that we were all fortunate enough to get through a very debilitating crisis as a nation, and that what we probably should be doing is looking to the future, not back at the past, because we've examined that 100 times to figure out if perhaps next year something like this happens again, what do we do and how do we do it? Director Walensky, I'm glad that you're here. I hope you use this as an opportunity to be able to express yourself in a way that you may have been constrained previously. We want to congratulate you on your work that you've taken part in and that you've led so many others in. Thank you for your accomplishments. I want to correct and affirm the record whenever I can. In your time as director of the Centers for Disease Control, you guided safe school openings of 100,000 schools and distributed the vaccine to 200 million Americans. And you've increased the aggregate number of COVID tests to almost 1 billion, funded medical research by directing your own budget internally to be able to do the things that were very, very important, and put in place an organizational structure that's much nimbler with a greater response time. So we really should be saying congratulations from this committee. None of us had that task. We know we're all here now with the microscope, but when you're in it and you're in the ring and you've got to figure out what to do and you're being measured every day, it's a very tough job. I am particularly interested in your work to address disparate health outcomes and to advance health equity. We have seen among affected populations just all sorts of things that cry out for greater attention. And in your tenure as director, you established the updated Office of Health Equity. Is that correct? Thank you for that. And you led the development of CDC's new equity-centered data system. Thank you for that. And for the first time in the CDC's history, you account now for social factors that have an impact on health, such as where people live and what's their income, what's their race, their age, their access to health care. Thank you again for that. Painfully, we've learned that during a public health crisis, we've got to be able to identify as well as care for the most vulnerable among us. And collecting and organizing that data will be critical, I believe, towards identifying vulnerable populations and ensuring their ability and to have resources and to thrive. I would ask you, though, if you could just take a moment in your own words and tell us what you think, quite frankly, are some of the things that we should be looking at as a legislative body. In other words, what legislation and legislative ideas would you suggest to this committee on the record that we perhaps could and should look at to begin the process of modernizing the country's data reporting system and how this change might in fact improve health outcomes for vulnerable populations?
Thank you so much for that. So much of what we are doing in CDC moving forward in our Office of Health Equity has been work that we can do internally, but we really do need your support. So for example, and I spoke a little bit earlier about our data systems, we have, data doesn't come to us necessarily with race and ethnicity data. If we can't see that those data that we have, or rural urban data, zip code data, if we can't see where there are deficiencies, lack of access, lack of vaccinations that are happening, then we don't actually know where to tailor our efforts. There are two things that need to happen in that regard. One is we have to stop using fax machines to get data to CDC. We need resources for data highways so that, and many of those resources are going out to jurisdictions, 3,000 jurisdictions reporting data to us. If those data highways are flowing, then we can actually receive the data and give it back so that County A knows what's happening next door in County B. It's also the case that we don't have the authority to, we act voluntarily, receive data voluntarily. That means it comes in non-standardized fashions. It doesn't come in with all of the information that we want. The example in the Mpox outbreak is we didn't know the race and ethnicity and of people who are getting Mpox or people who might have gotten the vaccine. Were we actually matching the vaccine with where the cases were happening? So we need some data authorities so that we can act nimbly and so that we can actually intentionally put resources where they are needed. The other is our workforce authorities. We've talked a lot about the attrition in public health workforce and healthcare workforce. Tax-exempt loan repayment, for example, direct hire authorities, fellowship hire authorities, danger pay, the fact that we have people in Ebola-stricken nations working but not receiving danger pay. These are all some of the authorities that a nimble, response-based agency should have.
Thank you. My time has expired. Thank you for your work.
Thank you.